Okay, so we just did the Weber test, and you had lateralization, which is a healthy, a normal finding, which is really good. Okay. Next, we're going to do the Ryan test. What I'd like to do is, I need to know that you can hear equally on both ears once I put the tuning fork. Basically, I'm going to be assessing air conduction and bone conduction. Okay. So let me know when you stop hearing the noise on your ear. Okay. And then we'll go from there. Okay, you still here?
Yes.
Tell me when you stop.
No.
Okay, we're going to do the next ear.
No.
Okay.
No.
Okay, great. So that was a healthy assessment of your conduction. Basically, air conduction is usually twice as long as bone conduction, so that seems to be panning out. So we're moving right along. Okay, next we're going to do your nose. First off, have you had any issues of runny nose, any allergies this season?
Occasionally here and there,
Okay.
but nothing terrible.
Anything you're treating it with?
Just Claritin.
Okay, that's right. You said you did take medicine for that. And that's working out? No rebound tenderness or anything like that?
No.
Okay, good. What I'd like to do first is assess the patency of your nares by having you hold one side. Take a nice deep breath for me. Does that feel clear?
Yes.
Good. For the other one. Good, good. Seems like that's panning out. Next, I'm going to look at the internal structures of your nose. If you could pull your head up for me, please. Yeah, I can tell you have it. I do note some polyps in there, but they're not very big. Usually that can become alarming when there's cancerous processes, or not that it's an abnormal finding, but usually with that structure, the size is bigger. Usually it could mean something like cancer, so you definitely want to have those checked, but it's not anything bad right now, nothing alarming. Now I'd like to have you close your eyes, and I'm going to do an assessment of your cranial nerve number 1, it's the olfactory nerve. Okay, if I could have you close your eyes. I'm going to give you 2 smells to smell, and I want you to tell me what they are, okay? Can you close your eyes for me, please? Okay. First one?
Vegetable or...
Close enough, good. Yeah, it's a vegetable drink. Good. Okay, next smell?
A cookie or cake or something?
Cookie's good. Great. Your nose is working just fine. Good. Moving right along, okay? Now I'm going to assess your face. I'd like you to smile for me. Okay? Can you give me a frown? Okay. Can you purse your lips for me? Okay? And can you puff out your cheeks for me? Now I want you to push against me pushing you, okay? Okay, great. Good. So that's good. Okay. Next, I'd like to inspect your throat, your mouth. It looks symmetrical. No problems with your smile. I noted that. If I could have you open your mouth. While I'm assessing the structures of your mouth, pull your tongue down. Okay. Can you push your tongue against your left cheek, right cheek? Inside. Okay. So I was able to assess your glossopharyngeal nerve and your vagus nerve. We'll do that. Okay. If I could just take a look at the mouth. Okay. The uvula is centered, midline, nice and pink. No evidence suggestive of infection, both viral or bacterial. And your tonsils are good. No dental caries. She's looking good. Great, no problems. Do you visit a dentist regularly?
Yeah.
Okay, good, good. Okay, next we're going to do your neck. What I like to do is palpate your cervical nodes and just get a feel for that, see if there's anything like edematous, anything tender, okay? First I'm going to start with your occipital. Good, no problems there. Post-auricular. Good. Pre-auricular. Good. We're going to do posterior cervical and anterior cervical. Retropharyngeal. Your submandibular. Your supraclavicular. And your subclavicular. Okay, good. I'd like you to extend your neck. I'm noting that your trachea is midline. No shifts or deviations there. Okay, now I'm going to assess your thyroid. I'm going to come to the back of you to do that, okay? Okay. Jay, what I'd like you to do is take a nice swallow for me. Okay, I'm able to identify. No problems there. Good, I did feel the shift, which is great. Good, let me just write a few notes down. Okay, Jay, so now what we're going to do is, I was able to displace your thyroid when you swallowed. Again, I told you there were no nodules, nothing like that. Now I'd like to have you shrug your shoulders for me, up and down. And this is basically assessing your sternomastoid. Can you turn your head for me? Okay, resistance is good, movement is good, range of motion is intact. Jay, if you could reach out and pull your hands up for me. Okay, I'm going to take this opportunity to assess her axillary. Great. Jay, at this